Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Rezki Mulyani. I'm from SIGD. In this video, I will discuss one issue of psycholinguistic, namely slurred language disorder in children. Before that, it helps us know the meaning of slur. Okay, what is leads? Leads or slur or we call chadel is a condition in which a person has difficulty pronouncing a certain letter or word correctly. Generally, the letter R. Although there are also some people who can actually pronounce the letter R, but a slur for another word. There are various variations of leads in children. Some say R becomes L, K becomes T, K becomes D, S becomes T. But every child has different variation. So a slur is an error in pronunciation. In Indonesia, there are many people who are slur. In the neighborhood where I live, there's a slur person. Name is Ulfa. She is 6 years old. She slur in letter R. For example, she want to say barangs becomes balang. Okay, in this slide, we talk about slur factor. Based on psycholinguistic characteristic, there are two factors that cause children to become slur, namely psychological factor and neurological factor. For the first, psychological factor. Psychological factor because of the presence of younger sibling. For example, to get the attention of parents, the children will imitate the speak style of his younger sibling. To overcome this, parents must show concern from him that will not be reduced by the presence of his younger brother. In addition, parents must tell their children to speak the correct language, not even to imitate the wrong pronunciation. And while a neurological factor due to damage the bronchi area are called aphasia motor, which make children slow to speak and their pronunciation is imperfect, so that is difficult to understand. Meanwhile, damage the area of the breakneck is called sensory aphasia, where the child can speak, but is it difficult for another to understand, and is it difficult from him to understand another people's word. Okay, in this slide, we talk about how to deal with slur disorder in children. According to ebook Indriyanti and 2011 on speak and language difficulty in children, parental therapy and strategy, how to deal with slur disorder in children. That is, parents must understand the stages of development in children. If the children, if the child experience delay in development stage, then parents must take a step to anticipate negative thing that can affect the child developmental stage. Because most parents do not understand and realize of sign of are sign of deviation from the child growth and development. A parent should take the child to the doctor to find out further what disorder the child is experiencing, how severe the disorder, and how is it handled. And then based on Indonesia language education, anal journal and literature on analysis of speech disorder for slur children by Cica Elinda Hanum Hatondang, 2019, slur people find difficult to pronounce the letter R because there are several factors that influence it, including, for the first, is environmental factor. Environmental factor can be caused by family condition at the learning stage. When the child interact with slur or speech, that habit of teaching children to interact like that has become a habit. Maybe parents think their children are still small and cannot speak R yet, so they are used to using the letter L substitute. And then the second is psychological factor. Many psychological factors say that the presence of younger sibling cause slur due to imitation habit, and less harmonious family relationship can cause slur. And the last is healthy factor, caused by disorder, speech and hearing delays, as well as genius that can be present on the children. Next is they'll talk about how to deal with slur discover children. In children, slur can be overcome by the way parents have to stop the habit speaking slur and guide the child to pronounce the correct speech. However, if the cause of the leads is due to a psychological factor of relative manageable, depending on the category of mild or severe, if included, if it is included the heavy category, it can be in from persistent leads, and if it's classified as mild, then the lead is not permanent. Leads can detect it until the child is 5 years old, because it's involved the brain system that regulate function, namely bronchial area. This area regulate the coordination of the vocal area, and rhythmic area are word understanding. Based on the journal Speech Disorder Analyze and Slur Children, there are several factors that cause slur. For the first is use of a pacifier. Using a pacifier for too long can cause the child to slur because when pronouncing the because the child tongue is pushed from forward and between in his teeth. This make the child unclearly when pronouncing the letter S and C. And then the second is tongue tie. This condition, also called ankyloglossia, is condition in which the frenula linguae that issue that stick under the tongue to the button of the mouth is too short. This condition will limit the movement of the tongue when speaking, and this usually occur from the birth. And the third is another psychological disorder. Slur can also be cause another psychological disorder such as hearing and brain disorder or abnormalities in the formation of the roof of the mouth. And then the last is environment. In this condition, the child becomes a slur not because of the problem with the physical development, but because his parents make it habit to speak with a slur accent with the children. So the little one thing that is the normal way of speaking to do. Okay, and the last slide, we talk about how to treat leads. As from how to deal with leads in children, parents can apply the following ways to treat slur in children. For the first is avoid using pacifier and get children to drink with straw. This sucking motion with straw can train the motor strength of the mouth. This is important to development his ability to speak. And then the second is practice the position of the child tongue and mouth when pronouncing letters that are difficult from him to pronounce correctly, so that your little one can remember it. Invite him to practice in front of the mirror. And the third is encourage the children to play games that can try to motoric straight of the mouth, such as blowing a toy trumpet or blowing bubbles of sharp water. And then the fourth is ask the child to try to make it his wishes clear before obeying him. And then the last is teach children as often as possible to pronounce how from letters that cannot be pronounced correctly. Yeah, that's all. That was its discussion about slur language disorder in children. I hope this video helped and provides knowledge about slur. Thank you for watching. Assalamualaikum warahmatullahi wabarakatuh.